All right, welcome everyone. Welcome back to episode 6. I can't believe we're already on, we did the whole wellness series. Now we're on episode 6, so interview 6. So this is episode 6 of our wellness advocate series. So if you tuned in last week, or if you didn't, last week we talked with Kira Walsh about mindset and how she's a motivator for growth and change in her professional life. So today we welcome Meghan Cook, and we will be talking about the topic of normalizing and highlighting the importance of helpers getting support too. So therapists, and why it can be super important and helpful for us to get therapy too ourselves. Meghan, thank you so much for being here. And if you don't mind, just kind of a brief introduction about yourself, including your background, current roles, just in the mental health and wellness arena.
Okay. Yes, thank you both for having me. I was really excited to be here today to talk about this topic because it's such an important topic, and I don't think we talk about it enough. So I'm really excited. My name is Meghan Cook. I'm a licensed independent social worker with a supervisory credential and also a licensed independent chemical dependency counselor. I've been in the field of social work for about 10 years. My primary work has been in the community corrections area, where I provide alcohol and drug treatment. We've evolved to even, of course, include mental health treatment, those types of things. But I started out as a counselor, a clinician, doing intensive outpatient treatment, individual counseling assessments, and then I moved gradually where I've been into more of a leadership type of role. So now I provide clinical and administrative supervision, as well as some training supervision. And I do, evolving with the times and what's going on in the world, I do provide part-time contract work telehealth therapy to clients, mental health.
Things. I love it.
Yeah. So that's my primary work, and so I've definitely had my share of experience and just knowing when to know myself and when I need to reach out for help, and being aware of when I'm leaving myself vulnerable, when I'm putting myself in a place where I might not be able to meet my clients' needs if I'm not able to function correctly myself. So that's definitely been something I've learned over the years, is that you need to take care of yourself first if you're going to take care of your clients. So.
Yes. Okay. So you mentioned, you kind of provide supervision, which is amazing. Meghan was like my first supervisor. Well, Meghan was my first like clinical supervisor. So we've come so far since then.
Yeah.
And how do you think that supervision specifically has changed of your clinicians since COVID?
Oh, wow. And this is something when I was thinking about this podcast, and I was kind of jotting some things down, and so much. I didn't think at first initially I was like, okay, there'd be a couple maybe changes here or there, but as I kind of got to writing and thinking about it, it's changed a lot. I mean, first and foremost, telehealth. You were providing telehealth therapy. Before, it was very limited. We didn't have kind of the protocol and procedures put into place to do telehealth. Clinicians weren't necessarily trained on that. So telehealth for sure. So not only was it like, how it just happened like in a week, it was like everything shutting down. And so for us, for myself, it was really, kind of just taking the time to take a few deep breaths and realize that nobody really knows what's going on. We're all going to be learning and growing together in this. And so I had to kind of disperse that and really work with my clinicians to understand that, okay, we're going to get you in some trainings. We're going to walk with you through this through these challenges, through this experience. Because a lot of them were a little bit fearful of what is telehealth. They didn't really do it much before. So we did some trainings with them, just more hands-on. Trying to get them comfortable. So some ongoing observations and things like that we did and we talked about, and there's a protocol we had to establish with etiquette, telehealth etiquette. How do you communicate to your clients what we're doing? So first of all, we as clinicians had to understand the telehealth etiquette, and then you're learning, and then you're trying to teach the clients. And that's a challenge within itself too. Tons of, funny stories with learning through this.
Yeah, I
And I'm
think we
sure
could
you,
make a whole episode on something like that.
yes,
Mhm.
yes.
You know,
So I'm
Megan,
sure
you could have joined us from the toilet today, right? That would have been
Right?
I could have
appropriate.
done that. Put a little background in the back. I mean, maybe,
Right.
get a little, what, like in a forest or something. I don't know,
Yeah.
but oh yeah, I've heard those stories too. Like you said, Amanda, it's funny. Yeah, clients we've had, in
Grocery
Walmart,
shopping.
Uh-huh.
laying in their beds you can, your imagination, even in meetings, like even in different work meetings I've been in, there's been a couple situations where, I kind of felt bad for a couple of people. I was like, oh, make sure your camera's on. So yeah, this has been a definitely with our client and our population, it's been a challenge because there are some clients that I work with that, they're not appropriate. You wouldn't normally have them be appropriate for telehealth. And so again, yeah, it's like teaching and just trying to navigate through all of that is how do we adjust and modify our practices to best meet the client's needs. It's better than nothing, not giving them any treatment. So, we had to adjust and modify things. And so definitely the first point there with how supervision has changed is definitely the telehealth and all of that. So some funny situations for sure that have happened. So as I kind of mentioned, to kind of piggyback off that, protocols and procedures, had to change. We had to be flexible. We had to make sure we were being more flexible to, again, meet the client's needs. Even the clinicians, they had childcare at home. There was, different problems, people that were high risk and susceptible to COVID. So again, trying to navigate through changing some protocols, procedures, being flexible and allowing and being accepting of that it's not going to be ran and structured the way that it was before. We have to adjust. So definitely protocols and procedures needed to change for that. And of course, I have to mention this, the increased anxiety of masks, no masks, gloves, no gloves. Because in the beginning, we didn't have a protocol again into place. It was just, we're working from home. We're not going to be doing in-person counseling anymore. We can't do that. We don't know what to do with that. So again, with DeWine and listening to that, being aware of what's going on and knowing how do we change our protocols and procedures based on what was going on in the world. So that fear and that anxiety of what's going to change tomorrow, what's going to happen tomorrow. And so that was definitely a challenge as well for me. And again, being a supervisor, you got to have your own, you have to be able to, I don't know, I think it's kind of like, I hate to, kind of reference it to like being a parent, you have to be the one in control, because if you're not in control, or if you don't have, if you're not able to manage your own emotions and your way of coping with what's going on in the situation, that's going to feed off your staff. That's going to feed off, your kids. So it's really important that I had to be very self-aware in their feelings, of just being more cognizant of how are they doing. Let me check in with them more. What are they doing for self-care? So I had to increase the amount of times we met. We usually do group supervision each Monday, and I increased that to 2 times a week there for a while because of all the different changes that were happening so rapidly. It was just so many questions all the time. And so again, I had to kind of manage my own emotions and anxiety to really just take a deep breath and say, okay, yeah, let me look into that. Let me figure that out. Let me modify that. Let me see what we can do in this area. So definitely the increased anxiety and managing not only my own emotions, but trying to navigate and work with my staffs as well was challenging, definitely for sure, because there was moments where, they want the answer now, and I get that, and that's part of that anxiety. So we talked a lot about self-care and what they were doing for themselves. And again, increasing activities we did together as a team. We would do lunches together just to debrief and, not talk really even just about COVID, just talk about what we did on our weekends, what we want to do, how we're doing, things like that. So
Megan, on that topic of feelings, I have an additional question that I didn't plan for. But we're gonna make the audience wait, and when we come back from this break, we're gonna talk a little bit more about feelings. Okay?
all right.
All right. So Megan, when you were talking about the heightened emotions, the heightened anxiety, all of those things, not only you, your clinicians, the clients, it all kind of feeds together.
Mhm.
How do you go about doing that in a supervisor role? I've really seen personally this shift in generations of where it was, you were taught supervision is work related. We don't talk
Mhm.
about personal life. Oh, you have personal stuff going on. Do you need to take time off? Do
Yes.
we need to cover your clients? Right? It was very
Yeah.
Like,
Mm.
something
administrative
wrong
and
is wrong with us because we have our own emotions.
right.
Mhm.
So how have you balanced whatever that expectation organizationally or, built into you of just stay focused on the job and really allowing people that you supervise to come to you with their emotions and their vulnerabilities without, I guess, crossing over any boundaries?
Sure. And that is definitely a good question because I experienced that so often throughout that beginning months where you did, first of all, having a good relationship and rapport with my staff, having those boundaries and incorporating that throughout our time together in supervision. So I've already kind of done that legwork prior to COVID and throughout when I'm meeting with staff, to let them know they kind of understand that boundary because we've talked about it. However, in this situation, like you said, it's challenging. I have to shift my mindset and my focus. I never ask. I won't ask more details than a clinician will provide to me, but if they've provided me information, I might check in on that. So I don't ever cross that line where I feel like, well, tell me about this, that, and the other, unless they've already said something to me about it. So I try to balance it and normalize it. I mean, I think, just with COVID, normalizing, this is a change. This is different. We're all experiencing it. It's something we all can relate to. Just kind of focusing objectively a little bit more on what is going on in the world and normalizing. Again, we're all experiencing anxiety, and again, they voice that stuff to me too, in the supervisions and about their work and their productivity. What are we going to do? Like, how do we do this? And so I worked with them. One thing that we had to do was, because we dropped off the groups, this was a huge challenge for us. How do we continue to produce revenue and operate a business when we don't have clients coming in to do groups anymore? So again, it was a very a challenging balance for me because my human side is, in our agency, we did a really good job of really, again, walking through that with staff. But that was a really hard challenge because, yeah, you do need to still make revenue and keep us operating. So we don't have furloughs and we don't have layoffs. And so I had to gently communicate that information to them that I'm here to support you. I'm going to work with you through this. I even took on a caseload and productivity during a little bit, not during the heightness of the COVID, but kind of once we got more things balanced and figured out. But I just walked with them, like, for example, just showing them we talked about different counseling techniques and different interventions to do with clients so we could have more individual sessions, because again, we couldn't do group anymore. So and then being positive, this is a good thing. We can now meet our clients more individually more often. So again, trying to balance, okay, we still need to attempt to make revenue if we are able to in light of all this, but at the same time, I'm going to be here with you. I'm going to support you. I'm going to teach you. And I'm going to take on some of that too, because we're all going to be responsible for that. So it's a good question, because that was probably the most anxiety I had through COVID was, yes, we were flexible. We reduced some things. We took some things off the table for them, for all of us to do that. But at the end of the day, we need to keep the lights on. We don't want to furlough people. We didn't want to lay off people. So I tried to gently communicate that to them too, that, let's make this positive. We can meet with our clients more individually and give them that attention they need via telehealth. It's more flexible for the clients and comfortable for them, and try to make a positive out of such a
Shifting that mindset and creating that environment in the workplace. Yeah.
So, all right. So the topic of today is, why does a therapist need therapy too? I don't want it to be such in a box, right? So I would say just even any helping profession. If you're on the front lines right now, I don't know, even if you're, you're doing IT somewhere, like,
Mm-hmm.
I think we could even expand this to why everybody needs therapy, but I know we're talking about why therapists need therapy too. So let's hone in on that. Like,
Yes.
why do you think helping professions in general should be seeking therapy?
I mean, just the conversation we just had, with all of the constant changes that are happening in the world. So for a few things, of course, our own work. So I start there. The reason that we need therapy is let's just start there. What we do is for a living is so tough and so challenging and so mentally draining. We talk about some clinicians and individuals in general are kind of maybe familiar with maybe secondary trauma. So a lot of what we do in our professions is taking on some of that trauma or some of that burden secondary. So meaning when I'm working with a client, they're throwing everything that they've been experienced in their life that's been traumatic onto me. And so I'm taking that on now. And over time, if you're not monitoring that, or if you're not taking care of maybe, that progressiveness of experiencing feelings of maybe depression or hopelessness or sad because you can't maybe help your client out of those situations. We do interventions, we give suggestions, we might give them feedback, but at the end of the day, it's their life. And if they don't make those changes and use the tools that we provide them, they could continue to progress in their illness and what's going on with them mentally. So I think sometimes when we're so involved with a client, you build that relationship, that therapeutic alliance with a client, that secondary trauma does happen because you have such a good, strong relationship therapeutically with that client. So you're taking that on and you're wanting to see them succeed so badly that over time, you kind of start to see that a little bit with the secondary trauma. And then secondly, of course, along with that, because I might be extending myself, I might also then have some compassion fatigue. Situations might start to look similar to me, or I might just kind of lose a little bit of that empathy that I might have because I do it every day. So a little bit of compassion fatigue might happen. And then, of course, what we know best in our field is burnout. When I'm extending myself so much and I'm trying to help and again, taking on all of that, where if I see a person's not taking those tools, resources, information, and feedback, I'm feeling like that hopelessness almost, or I might feel just anxiety or, some of the stress. And so I think definitely over time, the job, and as you mentioned, in any job, it takes a toll on you, what you do day in and day out. If you don't take care of yourself, if you don't check in with yourself and do something, then yeah, it's no matter where you're at, like you mentioned, Amanda, you might need some help to navigate through those feelings and emotions that you're experiencing from your job. But that's only just from your job.
Well, I want to say, it sounds like you still have more, but I do want to say, and we aren't just born with a package of skills ready to handle this, right? Like we learn algebra and we learn how to read and spell and write and all these fantastic things, but no one says this is what sadness feels like, and this is how we let it visit and then move on, and this is how we cope, and this is how we effectively communicate, and this is how we set boundaries with our coworkers, right? Like we aren't innately born with those skills. So if you don't have it, it's not a moral failure on your part, but recognizing that and then saying, okay, where do I go to get that support?
Yeah, no, and I agree, and I think it's always assumed, especially in our field, and I always kind of bring this up too, doctors can't perform surgery on themselves. Dentists can't work on themselves, just like clinicians, we can't work on ourselves, even though we have insight. Yes, we have really good insight into human behavior and that. But, there's that benefit and outside perspective and outside insight and feedback that is so important. Like you're mentioning, we might have all the insight in the world, but just like I just mentioned before, you need that support and that feedback to step outside. We're biased on our lives, and I don't know how many times I've probably I might have insight on a situation, but I minimize it. oh, it's not that big, because I work with clients that have, in my, view, a lot more problems than I do, but in reality, it's my problem, and I shouldn't minimize that. And that's that self-awareness piece of realizing, okay, because I'm minimizing, I'm not getting the help that I need, and even though I need it, or oh, I'm a clinician, I'm a counselor, I'm a therapist, I shouldn't have these problems, I'll be fine, So again, you're just kind of minimizing or justifying why you don't need treatment. Oh, they're just gonna tell me the same thing I tell my clients. So it's about changing our perspectives to that. Again, going back to, a doctor can't work on themselves for certain. We have our own bias, and we need that outside perspective to be able to stay objective, really.
Checking our own expectations, and we help others unravel how different aspects of their life are affecting them. So like you said, like having an outside perspective for ourselves can make us better therapists for our clients.
Yes. Mm-hmm.
So Megan, what tips or would you offer other mental health professionals who are looking for a good fit therapist for themselves?
Yeah, because I think a lot of people are like, but I mean, even me personally, when I was looking, I'm like, have I ever met them? Have I worked with them? Did they ever do a training I was in? Like,
yes.
It's so hard. And then that's another fear that blocks people. And they're like, never mind, I don't need to.
Yep. No, exactly. And before I go there, I just wanted to mention the two other areas that I felt with why therapists need therapy, because I think it's so important, is we only not just have our jobs, but now COVID has enhanced and exacerbated, our problems and our emotions, but also our own home life problems too, that I just wanted to quickly say would be another reason to look into it, because not only do you have COVID and the changes at work and the problems at work, but then you add your own life problems, with finances, family relationships, and so again, if we're not going to take care of ourselves, we can't take care of others. So, it's a struggle. But to your point with the tips, yeah, like you said, Amanda, when I was looking for one too, and again, it was just, again, we're taught in school, they tell us in school, and you think about it, you kind of put it in your back pocket, like, okay, they say to do that, but I think it's not until you gain the experience and you're in the field that you realize, oh wow, they were right all along. Like, you really need to see yourself. So tips. First of all, I think it starts with looking at what you're wanting in a therapist and checking yourself. So what I mean by that is, I'm going to be transparent with myself and genuine when I say, going into my first therapy session or going into my therapist session, I was there's a little bit of an ego almost. I mean, and I'm going to be honest about that. There's a little bit of that ego where you go in and you're like, who's going to be taking care of me today? An experienced social worker. Yeah. But so it's like checking yourself at the door and realizing that you're not in your professional role. You are a human being and you need help. You need somebody to talk to. And so first, checking your ego out the door and going into that session or wherever, I'll get to some more tips here in a second, but just going into that session, being open-minded, positive, and again, your agenda there as a human, you're there as a human needing some assistance. So just checking your ego. I'm not going in there to evaluate this person. That was my issue. I'll be honest, that was the problem going in at first, is I had to continuously remind myself. Yeah, I had to continuously remind myself that, Megan, you're not here to do a performance observation, because in my clinical supervising role, I go into therapy sessions with my clinicians all the time, and I'm evaluating their intervention, their technique, their MI skills. So it's like I had to check myself going in, because I'm like, no, this is not what I'm here for. So it was like, so it took me a little bit of time in the first session. I won't lie. I got home and I was telling my husband about it, and he's like, Megan, he's like, you're not there to be her supervisor, okay?
We're at home watching Netflix, and like we see a therapist on a show, and you're watching what they're doing, or
yeah, and that's exactly like what happened. I was like, John, you won't believe it, and he's like, Megan, what are you doing?
I think that's so human though, because I've told my husband before, because I get naggy, but it's really out of love from everything I know in my brain about mental health. So I've even told him, it's like, hey, IT like the back of your hand. So if I said, hey, honey, I'm going to do this thing on my computer, and it was going to like blow it up, you couldn't keep that information from me.
We'll just put it all aside, like,
It's hard to turn that off. So I appreciate that you brought that up because, same thing for me. Like my first session, I'm like, yeah, thanks for reflecting exactly what I just said, and so it's
reflection.
Right. And so I was starting to find myself spiraling out of that. Like, she's not even gonna be able to help me. See, why did I even bother? And then I'm like, Amanda, it's the first appointment. Stop.
Yeah. Oh no, I love that. I love that. And again, this is why I love these conversations. I love talking to friends and peers and colleagues because we can relate so much to it and relate so much to those feelings. Because, I did feel kind of guilty about that, having those feelings like going in, like I need to not have this ego going in, but I have this ego going in. And so it's nice to be able to kind of relate and talk to others that kind of experience that too. Yeah, because like you said, it's like any other profession. You go in, and if you're like a doctor, I mean, I know, I have some friends that are in the medical field, and they'll do the same thing sometimes. Oh, I went to the doctor, and so I think it's just a basic human response sometimes to that, but something to be very aware of, I think. So it's just something that I wanted to say because I think it's so important. You have to, but like you said, that was your first session. Even for me, it was like my first session. I had to, give it more sessions, So that kind of brings me to my next point. And my next tip is, of course, you want to find a good fit. You want to find a good fit, somebody that you, that have, can align with your, what you're seeking out, what you're looking for, what problems you're trying to target in treatment. So, going to someone that has more experience with children might not be what I'm looking for if I'm wanting to cope with my anxiety or my stress or, some of these other issues. So again, yeah, you do definitely want to find somebody that aligns with what you're looking for to target your problems or your issues. Even different agencies, like there are some agencies or private practices, it just depends on, there's some agencies that are more like aligned with like faith, spirituality. So those might be some places that you want to go, or more of like a private practice. And so of course, knowing what you're wanting to get into, but giving it a chance and being open-minded. And so that's why I say give it about 2 or 3 sessions, because the first session is going to be an assessment. They're going to have to ask you a variety of questions to even target what you might need, diagnosis, those kind of things, if there's one there. But then
it's not rapport building.
Yeah, no, not at all. Yes.
And gathering.
Yeah.
Yes, yeah, you're really just trying to gather information. Then the second session is more, now you're developing your goals, your treatment plan. So again, you're really not getting to the meat and potatoes of what you're really wanting to target. So that's why I say, I think by session 3 or 4, you do get to see the personality and the style type. I know for me, I want somebody that's laid back, that, I don't want to feel like it's a robotic session and that. So in my experience, I've kind of been able to observe both. One was, and again, she did have a little bit more experience. So I think maybe as an experienced clinician, that might be, but that's not always the case. So it could be somebody newer in the field. So I don't want to say, oh, because you're a therapist, you need to go to somebody experienced. I think it's just based on your level of counselor, or, where you're at in your experience. I know for me, and just having both, I prefer more of an experienced person, just because with the other one, I kind of felt it was more robotic. I felt that it was more not as genuine, but I understand that person is probably learning or whatever's going on. So again, my evaluation. So, so I got to stop there. But again, I mean, I think for me, I was looking at, am I comfortable talking to this person? Do I feel like I'm going to get what I need? And just in the approaches, I could tell, what I was more comfortable with and what I liked a little bit more. And again, I probably do need more experiences in getting it, in seeking therapy and having counselors see that. So, but I don't know. So that's what I would say would definitely be, you want to be with somebody you're comfortable with. So be open-minded and give it a couple of sessions, 3, 4 sessions to really see, is this something that can help you? And of course, finances, is another one. You have to look at your financial situation, what's covered by insurance, those kind of things.
I was going to say, just as a response to that, Megan, it's funny because you kind of like know what you want in your head. Like I always say, like, I would never see anyone other than a social worker, because I'm a
Yes.
social worker and I hang out with social workers and I really like us. Okay.
Yes, that's
And then, I ended up with somebody that's not a social
Mhm.
worker at all. She's an MFD and she, has her doctorate. And for what I needed at the time, her
Mhm.
bio and her experience fits me. So
Mhm.
I'll say, like, to that point, be flexible. Like, you might have a certain image in your mind, but don't just discount people because of one quick, decision.
I think it could be helpful to sit down and write just like a list, like of, on your gut instincts of what, like, qualities, and maybe less
Mm-hmm.
about qualification, but about, qualities and or specialties, and that kind of stuff could be helpful to just get it out of our own head.
Yeah, and I like that because my experiences have been with LPCs.
Mm-hmm.
So, like you said, it wasn't with a social worker. So, yeah, I like that you say that. And it's just about being open-minded and realizing we're humans and what we're looking for. Is to get that help, and hopefully you'll find that person that you get that therapeutic alliance with, and you feel comfortable enough. But I like what you said too, Kelsi. I mean, yeah, just sitting down and writing out, what do I want? What am I looking for in a clinician, and what's going to make me feel comfortable sharing? Because it's a lot of personal, information and therapy. So yeah, just not settling for that. So. But that would be some tips I would say. I've also been reading, I don't know if you've ever heard of her, Lori Gottlieb. I don't know if you say the name. It's maybe you should talk to someone.
Oh my gosh, I've been seeing that everywhere. I need to get it, apparently.
It's great though. No, I'm almost done reading it, and it's just normalizing it for us, and it makes so much sense to me. She's funny. She talks about different scenarios, experiences, the ego part of it too, and so that helped me in processing that. But it's a good book for sure. And I think another tip, just doing your research, would be that. But gotta plug that book in there because it's a good one.
I was hearing about it, so it's good to talk to somebody. Like, I've been seeing on Facebook groups or stuff like that as like a suggested read. So it's like, I should do that. But thank you, and we'll put that down in our link and stuff in our show notes, so that way if other people, whether you're helping professionals or not, we like to put any resources that our guests mention. So
Yes.
but did you have any other tips or anything, or even just just thank you in general, and any more tips or just comments or advice for our followers and viewers?
Yeah, so I just had like one last thing that I was thinking of, when it comes to being a therapist and thinking about, why we need therapy as well, and things to just kind of be aware of, as we're working with clients and kind of check in on. I look at this sometimes as my personality strengths sometimes are my weaknesses as well. And so I think things to not leave yourself vulnerable. So that's the only thing I had left that I wanted to just briefly mention. So my personality strengths, so just for example, is I'm easygoing, I can be fun, I'm energetic, I'm very approachable, those kind of things. But it does leave me to be vulnerable because you just have to be aware of, okay, that boundary. So those could be things that could be creating problems for you at work, is if you're not establishing and checking in with those positive strengths. So, my easygoing personality could sometimes be taken as passive. So maybe somebody will try to take advantage of me, or and those kind of things. Could do that. Humor, is my defense mechanism. To be honest, it's one of my strengths, but it's also a defense mechanism. So, not being aware not to laugh things off, and to take it seriously, and those things. So, yeah, I would just say that would be my last thing, is just being aware that your personality strengths, can leave you vulnerable, but also needing to have boundaries, being able to communicate, and self-care. I think are all things, just other tips that can help you as a clinician. Just check in on, are you hitting those areas? If you've got boundaries, okay. But if you're starting to see those that are becoming rigid, they're becoming passive, you might need therapy. No.
Too much of a good thing, black and white thinking, comparing
Yes.
yourself to others, right? All those unhelpful thinking
Yes.
habits that no one teaches us
Getting
until you go to therapy.
outside perspective, as if we would seek therapy, or I think that ties perfectly into the topic of having our own helper can
Mhm.
help us recognize those things more so than, we walk around and we don't necessarily have that perception of ourselves that somebody else does.
And it has a ripple effect into your workplace, your coworkers, your supervisees, your family, your community.
Yeah. And so I like to call those your protective factors at work. Yes. Yeah. So yeah, if you have boundaries, like you mentioned, good communication, you have good self-care, good support around you, and you have that self-awareness. Those can all be things that I think are protective factors as clinicians. And if you see one of those areas sliding, might be time for some therapy.
I love that. You should like write a book on protective factors for therapists.
Well, thank you so much, Megan, for joining us and talking about a topic that, sometimes can be taboo, and, just in general for us, it's like therapists. I feel like sometimes we have these expectations of ourselves, or others have these expectations of us as professionals. And, we're supposed to know how to handle our own problems, everybody's problems, all of that stuff.
Mm-hmm.
So I like breaking it down, and thank you for joining us to do that.
I wanted to say one, where you can find a therapist too. I don't know if I've done this for like a lot of clients too, the SAMHSA website. So I think that's the Substance Abuse Mental Health. What am I missing there? SAMHSA.
I got it.
Yeah.
We'll link it.
Yes, link it, because no matter where you're at, and I think it's for the United States, wherever you type in where you live and your address, it will come up with a bunch of different residential programs, substance use programs, intensive outpatient programs, bunch of different treatment agencies in your area. So, it's a really easy way. If I'm trying to find counseling, I just type in that SAMHSA, and it will tell you within miles where a place is located, or if they provide telehealth, all those things. So
I feel like I should have known that. I go to them for all kinds of things, but I never knew they had a directory like that.
Mm-hmm.
So just thanks everyone, listeners, viewers, for joining us today. Make sure you tune in next week, because we'll be chatting with Jenna. She is a licensed professional counselor, a trauma specialist, and an art therapist. So she uses art and mindfulness as a big foundation for her wellness work. So that's what we'll be tuning in for next week, the topic. So, but thank you, Megan, so much for joining us and talking about such an important topic.
Thank you for having me as well.
Thanks, Megan. And everyone, I'm going to put my little plug. Don't forget to like, comment, and subscribe.
Yeah.
If you don't subscribe, you won't know when the next episode's coming out.
We're booking like crazy. We're out into 2021 and just bringing all the people.
Share all the wellness information.
So
all
take
right,
care,
guys.
everyone.
We'll see you next week. Bye.